What's up everyone? My name's Dr. Christina Koblish and I'm the owner of Upper Cervical Chiropractic of Boulder. My practice is a very specialized form of chiropractic that deals with analyzing and treating the bones in the cervical spine. Upper Cervical Chiropractic is a highly specialized form of chiropractic care that deals with analyzing and addressing the bones in the neck. This is done in the most specific and precise way possible. All upper cervical chiropractors have studied traditional methods of chiropractic that you're probably familiar with. And they all do this by following a strict and repeatable protocol. Now, there's a reason that there's an entire technique devoted to just the bones in the very top of the neck. Your upper cervical bones surround some really important stuff. Most importantly, your brainstem. Because of all this important anatomy that sits right at the top of your neck, upper cervical chiropractors never, and I mean never, guess when it comes to how to correct the bones in the top of the neck. This type of chiropractic care works amazing for things like neck pain, neck stiffness, or not being able to move your neck through normal ranges of motion. But then there's the more neurological symptoms, and that's where we really shine. This means that patients with neurological symptoms respond amazingly well to upper cervical care. So things like Meniere's disease, trigeminal neuralgia, migraines and migraine headaches, any numbness and tingling that might be originating from the upper cervical spine all the way down to your fingertips, TMJ problems, sleep issues, sometimes even digestive issues. So in order to be the most precise and accurate with evaluating and treating this area, it typically means that upper cervical chiropractors are only focusing on and adjusting one bone in the neck at a time. We will then check and monitor this one bone and its healing progress and make adjustments as we go. This means that upper cervical chiropractors deliver the adjustment in a way that's very different than standard traditional methods for chiropractic neck adjustments that you've probably seen or maybe even experienced yourself. In order to isolate just one bone and to be incredibly specific with how we're making these corrections, the neck remains in a neutral position throughout the entire adjustment. This means that there's absolutely no anticipation of that neck twisting maneuver, and there's typically no popping or crunching sounds in your neck. In fact, most of my patients look up at me and say, "Is that it?" after their first adjustment. And I love to remind patients that the bones that we're working with are only a couple of ounces in weight. So it is actually an incredibly light adjustment to receive. Now remember, if an upper cervical chiropractor's goal is to be as precise and specific as possible when they're making their corrections, they have to know exactly where they're going. So one of the most important tools that an upper cervical chiropractic office will utilize is their imaging. And one of the most up-to-date ways to take imaging of the upper cervical spine is through a scan called a CBCT. If you've been to a modern dentist at all in the last few years, you've likely seen one of these machines before. It's a panoramic machine that spins around your head. It only takes about 30 seconds. But what this does is it creates an amazing, beautiful 3D model of your cervical bones. All of these are different imaging methods that allow the upper cervical chiropractor to gain a listing of your bones. And a listing is just a chiropractic word for the coordinates of where your bones are sitting in space. We then use these coordinates to make the appropriate corrections needed, one bone at a time. Another important tool that an upper cervical chiropractor might use in their practice is a thermography scanner. And I have to be honest, this is my favorite tool that I get to use in practice. A scanner like this allows the chiropractor to do a before and after scan with every single visit with every single patient. This means that as a patient, you're able to objectively see exactly what you look like when you came into the office and exactly how your body has changed after you've received treatment. This holds us, the chiropractor, accountable. And it also helps us verify that the change that we are intending to accomplish is actually taking place every single time that you come in to visit the practice. And so with each visit in the office, you know without a shadow of a doubt that your body is functioning better than before you came in. And even more importantly, this scanner tells us if you even need a chiropractic adjustment that day or not. This means that there are going to be many visits that you come into an upper cervical chiropractic practice where you receive a before scan and the chiropractor decides that you don't need treatment that day. That's actually the entire goal of what upper cervical chiropractors do. We are trying to teach the spine to hold the adjustments that we give you. Upper cervical chiropractors love to use the analogy of dentists. When you go get your teeth checked by the dentist, they're going to evaluate your teeth, they're going to take imaging, and you were just hoping that that dentist says to you that you don't have any cavities and you don't need any treatment, and we'll see you in a couple of months. Upper cervical chiropractors have the same exact goal. We want to have you come into the practice and we're going to follow our protocols. And these protocols help us identify, do you need any care that day, or do you need an adjustment, or can we send you on your way and see you in a couple of weeks? And slowly but surely, patients will start to hold their adjustments for longer and longer over time. 1 week of holding the adjustment turns into 1 month. And for some patients, even longer than that. So long gone are the days where you show up to a chiropractic practice, get your neck popped, and hope that that did the trick. Not only do upper cervical chiropractors address the bones in the neck with absolute precision and specificity, ultimately you can rely on the wisdom of your body's innate ability to heal and continue to repair on its own, without the need to come get checked once a week for as long as the future can see. Because upper cervical chiropractors virtually cut out all of the guesswork by doing before and after scans, taking precise imaging, and only adjusting one bone at a time and then evaluating, this means that patients in upper cervical chiropractic offices need less visits on average than a traditional chiropractor's office. Hopefully, if you've watched this far into the video, you're thinking to yourself, yes, 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 I want that kind of chiropractic care. There are a lot of chiropractors out there, which means that there are a lot of different chiropractic techniques. And certain techniques truly just work better for different types of people. I hope that after watching this video, you have a little bit better understanding of exactly what is upper cervical chiropractic and what makes us unique in the healthcare world. Thanks so much, and I will catch you in the next video.